October 10th, 2022 marked a medical milestone in Kenya's medical field. The first ever bone marrow transplant was done at the Nairobi West Hospital here in Nairobi.
When we talk about transplant, it means somebody is getting a form of treatment. It's a form of medical treatment which is actually trying to replace diseased cells with normal cells.
And as the world marks Bone Marrow Transplant Month, Margaret Gathoni takes us through her journey. She lived by the pill, not knowing what exactly she was truly ailing from, even though she was being treated for pneumonia.
Hii pneumonia, hatujui the type. I don't know whether maybe there are types of pneumonia. Kananishika na katoki. Kananishika hakatoki na kakona uchungu sana. The whole of my chest. Natibiwa, naenda nafanyiwa MRI. Kwa tu naendelea tu hivyo, isipokuwa siwezi fanya kazi kubwa, nikifanya nasikia na hema. So, nikaona tu there is something wrong with my body that has not been diagnosed.
It was until 2020 when she was diagnosed with multiple myeloma, a blood cancer that affects several areas of a patient's body, such as the spine, the skull, pelvis and ribs.
Sisi kwanza hatukujua multiple myeloma ni nini. Kwa tunafikiria tu ni ugonjwa na terminologies za medical. So nikugoja tu tuambie multiple myeloma ni nini na tutatritiwa aje. Nilikuwa tu naogopa kansa. Na by the way kile kitu mtu anaogopa kinampata.
After several procedures, including chemotherapy to treat myeloma, Margaret was admitted at the Nairobi West Hospital, where several tests were done to prepare her for a bone marrow transplant.
Alikuwa ametuambia sasa venye utakaa kwa room ambayo huwezi kuwa contaminated na anything, because wakati utalimuviwa stem cells, then uwekwe kimo itaua everything. Sasa utabaki hauna platelet, utabaki hauna white blood cells. Kwa hivyo hautakuwa na kinga. Platelets ni ya kuzuia clot, ni ya kuweka clot haiko. So vikatwa kidogo utabreed ukufe.
The hospital's chief medical director, Professor Andrew Gashi, says that a bone marrow transplant, also known as a stem cell transplant, is a medical treatment that replaces your bone marrow or your blood with healthy cells.
One of the diseases that we know that is affected, that affect the bone marrow is, of course, diseases like leukemias, lymphomas, myelomas, and so on and so forth. So the whole idea behind bone marrow transplant is to actually take out or obliterate all the abnormal cells and replace them with normal functioning cells.
Margaret remembers her treatment journey as one for the books, full of tests, donations of cells from family, just to mention a few.
Kila time we test, ndio unaonekane kama zinakuwa, kama white blood cells zinaanza kurudi na platelets zinaanza kurudi. So nikadonate na my family members wakakuja wakadonate.
To this end, Margaret, who is now well and out of pain, and her family lives to tell their story, giving hope to other Kenyans, reinforcing more confidence in the country's health systems.
They have connected a WhatsApp group for the people who have been done transplant. They always talk. So Margaret is like the first person to be consulted. They always ask her, how does it happen? People think that you are going to be, there is like opening your body.
I thank God, because every time I take my blood for tests, it has always been negative. We thank God for that.
Robbie Omodi, K24 Healthbeat.